As we go through the chapter in this book club, you can absolutely follow along and read if you want beforehand or read afterwards. That might also be beneficial in the sense that we've covered the chapter or the structure of the chapter, and then it can be easier to read afterwards. Sometimes if you go over the main bullet points and then when you go back to read it, it can be a lot easier than had you just read it linearly to begin with. And then feel free to also follow along in the book as we go over it, because I'm just going to be going over really important parts that I feel that are helpful to know, but also parts that I think would be relevant for the type of stuff that we talk about in this class. So I'll start with what is addiction on page 27. That's going to be chapter 1. Last week we went over the introduction. The first paragraph goes into what the next few chapters are about, and the next few chapters are about helping us understand what addiction is. And I think having a good grasp of the problem for many people then really clearly brings up what we need to do in terms of a solution. So I think where a lot of people fall off is that they just don't understand the problem properly. And so because they don't understand the problem, they're looking at solutions in different areas that are not effective for solving the problem. So basically what it says is helping you understand your loved one's behavior, your own behavior, and how they can change is what this is going to talk about. And what this does is it changes the way you feel about the addiction, it changes the way you react to it, and it changes the way you go about solving it. So for example, look, if you had somebody that had an infection, right? In medicine, we always say, once you understand the diagnosis, you understand the treatment. One of the things we learn early on is not to focus on the treatment, because once you understand the diagnosis, the treatment becomes really clear. So let's say you have somebody with a cough, and they have chest pain, and they have a sore throat. Now, you can take that person and you can say, let me treat the cough. Let me treat the sore throat. Let me treat the shortness of breath. Let me treat the chest pain. Let me treat the diarrhea. And there's medications for all of those individual symptoms. You can get something that suppresses cough. You can get something that soothes a sore throat. But if you don't make the proper diagnosis, if you don't take the constellation of symptoms and say, well, what's the underlying problem? What's the underlying disease? What's the underlying infection? And you say, let's run the right tests. Let's look under the cover, look under the hood. And then you got a diagnosis of COVID once you get your results back. Similarly with addiction, what tends to happen is people will say, my loved one is not acting like how they've acted before. So it's a psychological problem because their personality has changed. Or it's a legal problem because they are acting out with legal consequences, criminal behavior. Or it's a financial problem, like the money situation is problematic. They're wasting money or they're stealing money. Or it's like a religious problem because they're ethically not making the decisions. So you can figure out ways to soothe those individual problems. So you can talk about the legal problem and you can soothe that problem. You can suppress that problem. You can talk about the religious problem. You can provide them religious education, have them spend more time with religious people, have them spend more time with family. You can also soothe the psychological problems. And you can have medications and therapy that kind of suppresses that problem or soothes that problem. But once you put this constellation of problems or symptoms together and realize that, wait, this is addiction. This is an addiction problem. Once you have that diagnosis, then it's helpful because now you have a very clear path ahead of you in terms of treatment. Now, sure, treatment is different for different people, but what I'm saying is that there's a very clear scope of treatment options that you can try out now. And within that menu of treatment options, you find out what works best for you. But now you've really honed down what type of treatment you need to do for that loved one. So that's why understanding addiction, really understanding it well, helps us change how we feel about it. Maybe we can have more compassion for our loved one and help us in how to respond to it. Okay, then it goes on page 27 under the subsection, what is addiction? So this I like because they talk about all the different definitions. So they go into Webster's definition. And then the second paragraph talks about addiction in popular culture. I'm addicted to coffee. I'm addicted to this song. And then it talks about, likewise on page 28, likewise for many in our culture, the label addict defines a type of person. Now the second paragraph is where it leads into what we discussed last week. One description of addiction does not fit all. So more important than what does addiction look like is what does addiction look like in my home? And then it goes on to page 29 talking about what the Diagnostic and Statistical Manual of Mental Disorders, this is the DSM-5, where psychiatrists and therapists use this manual on how to diagnose mental health conditions and addiction. And so then it talks about the mental health diagnosis of it. And it goes on to talk about what really matters. We can philosophize on all these different concepts of addiction, but what really matters, and I'm going to read it verbatim, is the person having a problem or not? What are the specific variables involved with their struggle? We need to understand their specific route in and out of the problem. And then they go on page 29, they have about 5 bullet points of how addiction, although it shares similar features with many people, for example, in the DSM-5, the psychiatric manual that diagnoses these disorders, they diagnose addiction with 11 criteria, which basically you can boil down to a loss of control, continued use despite consequences, relationship consequences, financial consequences, legal consequences, and then cravings and a compulsion to use. A compulsion is a repetitive behavior that's difficult to control, like a tic. Okay, so the 5 bullet points on page 29 talk about how this definition of addiction can manifest in different people. So they talk about a 56-year-old construction worker, and they talk about how it looks in that person. It talks about a 45-year-old mother. It talks about a 37-year-old. It talks about a 28-year-old on meth, a 17-year-old that smokes pot. So you can get an idea of how addiction can present in different ways. Now, this is important because to really benefit from groups, classes, books, you want to be solution oriented, and you want to look at things that are in common with your situation. One large barrier to progress is fixating on how things are different. Like, okay, this is addiction, but addiction in my loved one doesn't look like that. There might be 50 things that look similar, 50 things that look different. And focusing on the 50 things that look different will prevent us from really seeing ourselves or taking that advice or getting that advice. So I'd be really cautious about that, because that's a pitfall. And we all sort of have that to some degree, but the hope is that we identify it as a pitfall and overcome it as a pitfall. And sure, when you hear people talk, when you read about addiction, when you learn about addiction, if you have the ability to look at information that applies and see if it can apply to your situation, learn from it, and you have the ability to let the rest of it sort of fly or to pass through you as something that's not necessarily important for you, but focus on things that are helpful, then you can go really far. That's a really important skill to learn. Then it goes to, doesn't science have a simple answer? That's the next subsection. And it goes on for the next page and a half to basically say, no, it doesn't. There's genetic vulnerabilities, there's environmental and societal factors, there's cultural factors. The important thing they say is there's no clean, this is the last paragraph in that subsection on page 31, there's no clean separation between these influences. They all interact organically. You can't remove biological factors, you can't remove environmental factors, you can't remove social factors, you can't remove psychological factors. You can only remove those theoretically in your mind to theorize about it, to learn about it. But in reality, it's all there, locking addiction in place or working to melt addiction and break it out of place. Then it goes on to the flexible brain. And it talks about the old commercial about where they would fry an egg and say, this is your brain on drugs, which was something that was done to increase awareness about drug use. But we've come a long way since then. So it talks about brain and the brain malfunctions that occur with addiction. And what's important to recognize is that there certainly are brain malfunctions associated with addiction. Nobody debates that. That's not a question. People with addiction to substances, their brain looks different than people who don't have an addiction to substances. Then what they go into is dopamine. So I'll talk a little bit about dopamine. Maybe we can just simplify the concept and we can wrap it up for today, because the rest of it we've gone through last week in the skills portion. Basically the brain, we can make it really simple. Look, I used to work in a hospital where every stroke had to be responded to. So we would carry a pager when we were on call, and when there was a stroke, I would get paged and I would have to run to the stroke room. And then I would see a patient having a stroke and I would ascertain what needed to happen next. But part of that protocol was, a stroke is when you have a blood clot that damages, or some sort of something that damages your brain, which leads to something in your body not working. And that's how they pick up a stroke. The nurse is in the patient's room and all of a sudden they can't speak, or all of a sudden they can't use their right arm. Then there's concern for a stroke. The code is called and then the doctor runs into the room. Now, what's interesting is I would come into the room and I would evaluate them. We would do this full body evaluation to see if the arm's working, the legs are working, different parts of the face are working. And then we would rapidly be able to identify one body part that's not working. Then based on what wasn't working in the body, we would be able to predict what was going to be damaged in the brain. And sure enough, when the patient would go under the brain scanner, it would correlate with what was damaged in the body. So long story short, it's really simple. When something's damaged in the brain and part of your body stops working, then there's a connection made. So if the left part of my brain, the upper left part of my brain is damaged, and then my right arm stops working, now that's called your right arm center. If another part of your brain's damaged and your speech is affected, that's called your speech center. So it's a really simple concept. And one example I've used in the past is, it's like being in the dark and there's a garage door button and you're pushing different buttons, and you push one button and the light comes on, and then you push another button, and then finally you push the right button and the garage door opens. It's like that. It's like you're fumbling around in the dark, you push a button, something happens, you push a button, the light comes on, now you know that's the light button. You push another button, the garage door opens, that's the garage door button. Similarly, that's how we can identify what's going on in the brain. Now comes dopamine. What they did was they took laboratory mice. They genetically engineered them to deplete them of dopamine. And what they found was these mice lost the motivation to do anything. They would not even be able to walk a few feet to eat food that was placed directly in front of them. And they would starve to the point of death. And so that really highlights the importance of dopamine and how important it is for the brain. Now, when you look at laboratory rats, they look at what increases dopamine in the brain. So they find that chocolate will increase the basal output of dopamine by 55%. Intimacy, 100%. Nicotine, 150%. Cocaine, 225%. And amphetamine, 1,000%. So you can see the difference between dopamine released from chocolate and dopamine released from amphetamine. And that's really important because dopamine plays a big role in motivation to get a reward. So it's really important in wanting things, more important than in wanting things than liking them. So if you can imagine this important neurotransmitter involved in motivation hijacked by substances, and now you have somebody that is motivated away from natural rewards that really can't match what drugs and alcohol provide. You have somebody that's motivated to use drugs and alcohol because it's hijacking their reward pathway. So they no longer are motivated sufficiently to natural rewards like food, drink, social relationships, because the drugs and alcohol are hijacking their brain and motivating them towards using drugs and alcohol again. It's tricking their brain to say, hey, this is important. Not that. This is important. The drugs and alcohol are important. This is what's needed for survival. So it's something that really hijacks the brain to the point where now that person is managing, fixing, coordinating the use of substances without their conscious control. And this is the experience of people with a substance addiction. It's almost as if at times their brain is dragging them along with it. Oftentimes in the middle of a relapse, after a period of sobriety, many people will express that they almost feel like they became consciously aware of what was going on while they were already in the car to go get the substances, or after they've already made the decision and started taking steps towards getting the drugs and alcohol. That's not to say that there's no free will or there's no will here. And to say that somebody has a disease-like state with addiction, or that addiction is akin to a disease, doesn't mean we absolve our loved ones of responsibility for their actions. It means that we can have a little bit more compassion for it, number one, but number two, more importantly, it requires them to have more responsibility for their actions. So now, going back to the COVID example, now that I'm diagnosed with COVID, great, I have a treatment, but now I have an added responsibility to rest, to isolate, to wear a mask, to follow certain rules, and to make sure that I'm treating myself. So you have somebody that's sick and they say, well, I can't keep up with my family relationships, I can't support myself, I can't go to work, I can't do this, I can't do that. because of my disease, that's no longer an excuse once the treatment comes into play. So once you know I have this disease that has a treatment, I can no longer say I can't do my job or I can't engage in my family responsibilities. It moves from something that is outside of my responsibility or something that requires us to simply have sympathy for, to something that requires that person to take the added responsibility to get help. So I can't say I have a disease, I can't do anything. I have to say I have the added responsibility to get treatment in order to treat that disease so I can go back to functioning in life. That's what we mean by addiction being akin to a disease. What we're saying is that there's a treatment, and that's the point of having that conversation or having that conceptualization. Again, it's not to say that, oh, my loved one has a disease, they have the right now to do anything they want to me. That's why many people will have resentment to the disease model, because they feel like that's what it's suggesting. That's not the case. Okay, finally, we talked about a lot of similarities of addiction. We talked about different factors that lock addiction in place. We talked about a basic brain malfunction that's shared by all people with an addiction. And finally, on page 36, it sums up a very important part of the conversation, is that addiction is different for different people. People will use drugs for different reasons and will have different negative effects from it, and for that reason it should be treated in a different way. On the last page, it talks, so page 43, it talks about an exercise. These were the questions that we had gone over on page 43 last week to look at what addiction looks like in our households.